Good afternoon. Good morning to anyone on the West Coast. I'm Kara James, President and CEO of Grantmakers in Health, and I want to welcome you to today's conversation on investing in transformative change, helping states and communities align and deploy federal funds. We are really excited to have this conversation at a quite crucial and important moment in our society as we are coming out of quite a year that I don't need to repeat for everyone, but a lot of lessons learned. And we have an opportunity through the CARES Act, the American Rescue Plan Act, as well as potentially the future allocation through the infrastructure bill to really think about how we rebuild and transform our communities to make sure that people have access to the health and educational opportunities to build healthy futures. And at the same time as this is a great opportunity, it's also presenting some interesting challenges as this is, lots of money that is on a scale that many have never seen before. Some communities are not necessarily prepared in states to think about how to spend the money best and allocate that. And we wanted to bring together this conversation, continuing on a bit of a conversation we had last week with some funders and others to think about how we can help communities at this time to make sure that diverse voices are represented, key needs and opportunities are identified, and plans are put in place to best use the resources that are coming to really truly transform the communities to lead to better health and better outcomes for everyone. So in today's discussion, we are really excited to be joined by Jeff Levi, who is a professor of health management and policy at the Milken Institute School of Public Health at the George Washington University. And we will be subsequently joined by Neil Steinberg, President and CEO of the Rhode Island Foundation. Jeff is going to spend a few minutes just setting the stage for where we are and what's coming to make sure everyone has a grounding. And then we have invited Neil, who's been in this role and thinking about how foundations have been able to engage, and the Rhode Island Foundation is one of those examples. So we wanted to share some of the lessons that they have and hopefully lead to a rich and robust discussion between the rest of us. So with that, I also want to just encourage everyone to make sure you're chatting in your questions. We are going to have Jeff's presentation, and then we're going to go right into Neil's, and then we will circle back on questions because we have a limited time with Neil before he needs to return to his appointment. So please use the chat, and I will turn it over to Jeff.
Thank you, Kara, and thanks to all of you for being here today. And all I have to do now is find the right screen to share. I'm delighted to have this opportunity to talk with you. We are, as Kara mentioned, at this unique moment in probably all of our lifetimes where the federal government is making massive investments in communities across the country. And so this is an incredible moment and opportunity if we seize it and help to shape it. And it is certainly my view that foundations at all levels, but particularly at the community and state level, should bring some expertise and knowledge and capacity to convene in a way that can really make these new investments truly meaningful. And, just to sort of my bottom line up front is foundations have an incredible opportunity to help governments as they make decisions about how to spend this unprecedented amount of money. And actually, the smaller the government, the less experience they are likely to have with managing large amounts of federal dollars. And so the experience that philanthropy brings to the table in being able to manage large portfolios is incredibly important. But this is also an important opportunity for many of your grantees, for those community-based organizations out there who may not have experience in applying for federal funds or for government originated funds, but for whom this could be a tremendous opportunity also to do some rebuilding and expanding of mission and getting some help in just the application process and in managing new inflows of money could be incredibly important. And this is also an opportunity for foundations to think about leveraging the prior investments they have made in communities. My guess is that the creative uses of these funds are probably things you've already funded in your communities to one degree or another. The federal funding that is coming forward now is an opportunity to bring that money to scale. And it's also an opportunity to work with governments at the state and local level to make sure that your ongoing investments are coordinated with theirs. So that's sort of the context in which I hope you will listen to this brief overview and get a sense of what is going on. These are breathtaking levels of funding. It is not just the American Rescue Plan Act. We had the first supplement. I don't know where I got lost, but there's been multiple sources of funding, not just the American Rescue Plan Act. As Kara mentioned, there's going to be more coming. There's going to be the fiscal 21 appropriation. There's going to be possibly the American Families Program, and as well as the infrastructure investment. So there's a lot more to come. Certainly some of this money was meant to address surge needs that were specific to the pandemic, and a lot of this money has also gone to individuals with economic needs as part of our safety net. But there are also opportunities for major investments in what the administration is calling Building Back Better, with a lot of flexibility to state and local governments to address underlying social determinants of health and other system deficiencies, and to address health problems that have been neglected during the pandemic. In particular, the administration keeps focusing on sort of the behavioral health, social connectedness issues that we have all seen during the pandemic. So there's some opportunities and challenges associated with this. There is $350 billion divided evenly between state government and local governments. That was meant as fiscal relief money because the assumption was that the pandemic had a dire impact on people's revenue, on state and local revenue, and they needed resources to make up for that deficiency. As it turned out, as you're beginning to see, I think, in the newspapers, many places actually had surpluses. And so this money now can be used less to fill holes and more to really build a new capacity and new infrastructure. And the tremendous opportunity here is the administration's commitment to equity as a lens through which all of these investments are to be made. There's wonderful language, not just in the president's executive order around equity, but also just in, if you have insomnia, I recommend the Treasury interim rule on how this fiscal relief money should be spent. But embedded in that, those incredibly complex discussions that I will never understand of how you calculate lost revenue are also really amazing commitments to equity and redressing some of the underlying systemic racism that drove so much of what was problematic in both the impact of the pandemic and our response to the pandemic. But as we think about addressing social determinants, we have to think about how money can be used in a cross-cutting way to address those social determinants. We need to make sure that community voice is heard, that multi-sector collaborations are put in place to design how this money is spent and then actually implement the programs that are necessary. And we're also going to see challenges around government agencies being able to spend this money efficiently and quickly. It is not one-year money, but nonetheless, this is not going to be easy for governments to spend quickly. And is there a role then for intermediaries to help them in that way, whether it's through hiring or through contracting with community-based organizations? And obviously, the purpose of today's discussion is partly what foundations can do to offer assistance to states and localities as they try to figure out their efforts. This, we will share these slides because there's going to be some detail here that you may want, and I'm not going to walk through. But this gives you a sense of the scope of the investment. So there's the $350 billion in state and local fiscal relief, but there's $122 billion going to local education agencies as just another example. $6 billion going to community health centers, $5 billion around through HUD for housing, and then billions and billions of dollars pumped through the CDC to address both the response to the pandemic and rebuilding the public health system. And the most recent announcement in that regard is $7.6 billion for state and local health departments around public health workforce. So this is just an incredible range of opportunities. So with some help from some colleagues out in California, we actually tried to paint a picture of what this looks like in California. Obviously, this would be adjusted based on your state's size, but this gives you a sense that there's over $30 billion that the state will control and over $30 billion that local city and county health department, city and county governments will be controlling. And it's again distributed across these programs. You know, California is a good example where there was a prediction of tremendous deficits, and as it turned out, they now have a $75 billion surplus. And so when you think about the kinds of investments that the state alone could make between the $75 billion surplus and the $30 billion in state fiscal relief money and other pots that we see here, that's an incredible opportunity to reshape how we think about health, how we think about an equitable society. So Kara mentioned that in collaboration with grant makers in health and the Georgia Health Policy Center, we convened some folks from philanthropy, from public health, from CDFIs, from human services agencies, from community-based organizations, from advocates, to talk through some of these issues. And the consensus at this convening, which is not going to be surprising, is an understanding that community health and well-being are achieved through a multi-sector approach that is not going to be limited to healthcare and public health. But most importantly, we need coordinated plans and strategies at all levels of decision making, so that when we think about all of this money coming in different funding streams, that it's going to be important to at least virtually grade and blend these funds so that there's some really clear objectives stated for those investments. North Carolina is one state that has started down that path. Others certainly can be doing that. And thinking about the multiple funding streams is going to be very important because a lot of the focus of attention right now is on the American Rescue Plan Act, but there, as I mentioned, are, just for public health workforce, $7.6 billion going out to states. There are states seeing unprecedented amounts of investment in their public health systems, and we need to make sure that those public health systems are modernized in a way that is coordinated with and creates health departments that do become their chief health strategist for their communities and think beyond the four walls, not just of a clinic, but of the four walls of a health department in terms of what, with their knowledge and information, they can leverage from other sources and with other partners. Community leadership is going to be very important. Engaging communities in this decision making is a form of power sharing, and I believe is a way of beginning to start to address systemic racism. I got into public health through HIV, and we know how to do this. The Ryan White Planning Councils are a perfect example of how you can engage communities in this work. There was also a view that while we're looking a lot at what state and local governments are doing, the federal government has a role to play as well. They can provide leadership, they can provide incentives, they can provide technical assistance, and even after they've granted the money, they can be providing guidance. And of course, as I've said before, people don't live in silos, but government programs and funding often do. And so there may need to be intermediaries who can be essential to both planning and implementation to create the vision for braiding funds, and in some places serving as fiscal intermediaries as well. And as I mentioned at the beginning, there are some smaller communities that may never have managed federal dollars before and need some help. But when we think about intermediaries, whether it's in the planning process or the convening process or in just managing the funds, we can think of community foundations. New Jersey has health hubs that are a really good model of that. Accountable Communities for Health is another, public health institutes, CDFIs, wellness funds. There's a variety of entities that may already exist in communities that can do that work. So that's really the bottom line, and I look forward to hearing and answering any questions. In the slide deck that we will share with you, just scrolling through this will give you a sense of just how complex this is. These are links that you can find how much money in each of these buckets your community is going to be getting. Unfortunately, there isn't a single place where you can find the answers to those questions, but this gives you a sense of the scope. And I would add, this is not a complete list. So with that, I will stop and look forward to the discussion.
Thank you so much, Jeff, for that overview. As I said at the beginning, we would encourage you to put some of your questions in the chat. We're going to go right immediately to Neil Steinberg of the Rhode Island Foundation, as I said, since he has limited time with us. And then we will come back and ask any questions and have discussions. So with that, I will turn it over to Neil, and thank you so much for joining us.
Thank you, Kara. Thanks for asking. And Jeff, having listened to your presentation, you laid the foundation of what I'm going to say we're doing, including you leaving off on community foundations. And we're a community foundation. I can also vouch for the fact that I did fall asleep trying to read that act a couple of weeks ago. So it does work in that regard. So just to set the stage, my name is Neil Steinberg. I'm honored to be here with you. I'm the CEO of the Rhode Island Community Foundation, and we have a unique situation that we are a very large foundation in a very small state. We're a statewide community foundation with $1.2 billion in assets, and we're the biggest funder, et cetera, et cetera. So we do a lot. Health is at the top of our priorities, as is education, economic security, and equity, and all of these things. But to get to the point that was so well laid out by Jeff, what I'm going to tell you we're doing is we are going to be convening. We already are. We've convened a group, and I'll give you a quick background. But this was born out of just candidly, whenever the announcement came out, and just to scale it, and I'm sure many of you are from much bigger states, but Rhode Island, from the ARP money, is getting $1.2 billion of that unallocated, so-called unallocated money, not the buckets that are in all those references, but the $1.2 billion to use over the next 3 years. In addition, another $500–600 million for cities and towns. And my first thought when hearing that, when seeing that, was that this was like giving a teenager a lot of money. More dumb things can happen than smart things. So we don't want to see the kegs, and we don't want to see the new cars and stuff. We want to see the smart decisions being made. So we have a long history of convening. We've done long-term planning on healthcare and long-term planning on education. So we came up with the idea that we were going to convene a group. And we were going to convene a group of big picture, smart people around a table and brainstorm. And in order to do that, we would sponsor that, so to speak, at the foundation and lead it as we have before. If there was any funding that was needed, was fine. And we went to two organizations that we have locally here to work with us and support us. One is an organization called the Rhode Island Public Expenditures Council. That's the business advocacy and research group. So we then went to the other side of the aisle and to an organization we have here, the Economic Progress Institute, which is a more progressive think tank, and put them together to work with us on this, to do some of the research, to do some of the legwork. We then put together a group of 15 people that we picked as individuals. So we did not do the Noah's Ark, 2 from here, 2 from here, 2 from here. 15 people, 8 men, 7 women, and 45% people of color, ranging from the president of a local college to somebody who was an engineer, to somebody who's worked in housing in the nonprofit sector, people that we knew. And that was the hard part, because we got phone calls afterwards, how come I'm not on this group? And, I'm very fortunate. I've been around a long time. Doesn't bother me. But I'd ask them, why do you want to be on this group? And they tell me what they wanted to get. And so they answered their own question. They weren't on the group because they were special purpose advocates and they were lobbyists, and they were trying to get something where this is big, once in a lifetime dollars. I then went, as we've done in the past, to our governor, to our Speaker of the House, to the Senate President, said, we're going to do this. We're fortunate that we're not part of the state hierarchy, so we don't actually need permission, but we always do these things collaboratively and together. They were thrilled to hear it, because we were presenting a way to get input. And the thing that really sold it, and Jeff, you hit on the head, was we committed to getting robust community input. So we said, we're going to form this group, we're going to do this. And in fact, they told us, especially the Senate and the House, take 6 months to do it. Our fiscal year, June 30th, they did not want to crash this in and try and decide on this money by the end of the fiscal year. Again, as you noted, we're not in as dire straits as everybody thought we were going to be, so we've got a small surplus. But the recognition that we need to do this in a thoughtful manner. The charge that we have set out for this group, with this group, is we're going to come up with 3 to 5 big ideas. Sustainable ideas, transformative, equitable, you could throw everything on there. We've all had experience with big federal grants where new programs are started and those programs end the day the funding ends. So how do we keep this going? And whether that's digital divide, whether it's housing, whatever it is, we've had our senators being very supportive of this, spoke to us, talked about some of the ground rules, not using it to lower taxes, which half the population wants to do, and not being used to plug pension holes. The other reason for doing this, and this came up recently, so it was after we already started working on it, was we had an institute at Bryant University here that did a public opinion poll on this. And the headline was 48% of the respondents do not trust elected officials to decide where this money is going to go. So while we didn't have that at our back when we decided to do that, it gave a little more heft to people wanting to listen. So we've convened this group. We're working on a group. We've come up with guiding principles. We're coming up with a public outreach process that will be focus groups. There'll be community meetings. It will be one-on-one meetings with different groups. We set up an email address where anybody in the state can send us an idea. We've got about 150 or so ideas, ranging from absolutely lunacy to big honking things that we all know about. It's hard to think about this much money. A lot of the nonprofits who are the ones we support, they want grants. They want a $250,000 grant out of this. We fully understand that we do not have any authority. So we're convening, we're thinking, we're researching, and we're going to present options. If the powers to be use half of this before we get to the end of our time, they use half of it for something. We can't control that. But just to give you a quick idea on these guiding principles, the first one has to do with equity, and it is address the root causes and conditions of systemic inequalities based on race, gender, disability, economic status, and other historically marginalized or oppressed communities, which predated and were exacerbated by the COVID pandemic. Sustainability, these ideas should deliver enduring change and solutions that enhance the resilience of impacted communities. The impact should be to transform economic opportunities and quality of life and build community assets for impacted communities for the short and long term. And the process should reflect both broad input from impacted communities and public stakeholders, as well as solid data and research. That's somewhere between motherhood and apple pie and brilliant thinking, depends how we want to think about it at the time. But it was designed, again, referencing Jeff's great summary, to fit with what we saw come from the feds. So we're about 6 weeks in. We said we're going to get this by September. We are just now formulating how we're going to do the outreach. And then we will look at topic by topic. And the hard part that we've come up with is when we talk to one of our senators, Senator Whitehouse, without knowing what's coming down the pike, will there really be a robust infrastructure bill? Will there be a family act or whatever? You run the risk of wanting to spend this money when there'll be money coming down the roads. And then the last thing I'll mention, which, Jeff, I don't remember if you mentioned it or not, this big dollar amount that the cities and towns are getting. If we were concerned about what the state was going to do it, holy cow. I've joked that we're going to have some of the best football stadiums in the Northeast from some of our banana mayors. They don't know what to do, and they've been allocated money. This process, we've offered to collaborate with our League of Cities and Towns and keeping communications, but I don't know, left to their own devices, where that money is going to go. And it's more money. City of Providence, for example, again, some of these numbers are, the Rhode Island numbers, but they're getting $166 million. That's an incredible amount for them. They've already scooped $33 million to balance their budget. Whether it's going to be used for, a trolley somewhere or whatever, we don't know, but we're gonna come up and try and stay true to what we're doing and be as inclusive as we can, get input and come up with these 3 to 5 big ideas and go obviously a lot deeper. Of course, anybody will say housing, opioid crisis, all of these things, food insecurity. How do you actually do it? Is it enough money? It may be very humbling to find out what it really costs. How is it going to be done? And at the end of the day, we want to get to the point where all together, we're not sitting here in 5 years and somebody says, hey, whatever happened to that money? And the risk of that is humongous, in my opinion. It is a lot harder to spend a lot of money than to spend a little money. It's very easy to split up with a whole bunch of $1 million projects. Thinking about $100 million, $200 million, $150 million is very challenging. So sorry to talk so fast. I want to be respectful of your time and just give you an idea what a community foundation is doing in a state and trying to be inclusive. We will go out proactively, and the expression that we always use when we do these, we want to bring the rock throwers under the tent. So there's going to be people that are critical. You didn't ask me. All right, we're asking you. You didn't consult this neighborhood or something, and try and get to the top level with these. So I will stop there, Kara, and
thank you so much, Neil. That was great. And I'm sure there will be a number of questions. And maybe while people are figuring out their questions, I guess, Neil, I have a question for you in terms of how you guys came up with those guiding principles for your work and the outreach that you're doing to try and limit the number of rock or minimize the number of rock throwers outside.
Yeah, so the very first meeting when we convened this group of 15, as well as our partners, our research partners, the group decided, gee, we got to have some guiding principles. And we debated back and forth, are we doing guiding principles for our work, or are we saying these are the guiding principles when people decide how to use them? And at the end of the day, there really wasn't any different. We shouldn't be recommending anything that we didn't feel strongly fit. And we just hashed them out. We've done this before. I facilitated it, and we broke up on a Zoom call, two breakout groups with the 15 people, had them facilitated by our 2 partners. They came back. We did a straw man of these. The only thing that we enforced was it can't be 10. It's got to be 4 or 5. And we have to be able to say them without reading them, so they can't be 5 paragraphs. And I hope I'm not offending any academics that may be on the call, but I always describe that we're doing this pass fail. We're not trying to get the A+ on this. So we did that in a roundabout, get ideas, put out a stalking horse, have people respond to that, finalize it. And then I say, we got to get it done in this meeting, and we got it done. And we also asked people to agree if they're 80% okay. You can't get anybody to agree 100% on anything anymore these days. So it's like, if you're 80% okay, and maybe you would have changed that word or this word or whatever. I know somebody asked, I'll be glad if you tell me where to send them, I'll send them to you. But we use the term impacted communities. And so we'll get asked, impacted communities, is that impacted by COVID or impacted by race or whatever? And we say, yes, right? It's impacted. You tell me what's impacted. And but a very strong social equity component in there, as was described in the act, as we've seen here. And as far as those rock throwers, we just have the advantage of knowing who they are. So if they haven't already called and yelled at us, we know where to find them, and said, so we've come up with a list to our partners, said, here are some you have to talk to. I don't care what they say. I don't even care if they don't return your call, but we can't say you didn't reach out to this particular group or that. And, that's being a little wise guy, but the goal is to be inclusive. But we've had a lot of people call us, and somebody wants, more money to the airport to get better flights, things like that. And we just very respectfully say, thank you very much. We'll factor it in and go on our merry way. What we found is there's a real hunger, even broadly, for people to be able to express their interest or ideas, even if you never use them. There's not many venues people have for that. And government, so where our government leaders really bought into this, I think, is we're air cover. Or the air cover for this. They didn't come out of the block saying we need this, that, or whatever. They don't really know. So I see it. Yeah. So
you've got a couple questions in here. A lot of people are interested in how you've been pulling together the group, and I will start with one, probably the easier one. You read off the principles that were guiding principles, and I'm wondering if you might be able to read those a little slower so that folks can get that again.
Yeah, that's fine. I'll read them and I'll send them wherever you want me to.
Okay. Yep. We'll get that from you as well as
four guiding principles. Number one addresses equity. And so this principle says, address the root causes and conditions of systemic inequalities based on race, gender, disability, economic status, and other historically marginalized or oppressed communities, which predated and were exacerbated by the COVID-19 pandemic. Then we want to address sustainability. And that second one is that these ideas should deliver enduring change and solutions that enhance the resilience of impacted communities. We then got to the broader term of impact. And the third one is transform economic opportunities and quality of life and build community assets for impacted communities for the short and the long term. And then we want to address process. So the last one is that these principles, these ideas will reflect both broad input from impacted communities and public stakeholders, as well as solid data and research. Everybody in the United States knows there's a housing crisis. Everybody in the United States wants to do something about it. Everybody sees the cost going up faster than the supply, and nobody's figured out what to do about it. So I don't know if we can get to that, but those are the type of things we're going to do. I see another one here that really attracted my attention. We're one of the bluest states in the United States, and the question is, what are your suggestions for making suggestions in a conservative state, highly partisan and divided? This comes from leadership, and I'd say assuming the leadership doesn't already know. I mean, if they've already said, here are the things we're going to do with this money, and it either agrees or disagrees with somebody's principles, I don't know what you do. We're agnostic to that. Again, we will have some balance, but it will be admittedly more the other way. We just invite them to the table, and very frustrating to still do it by Zoom. We're used to, we're in this little state where everybody can get here in 45 minutes. The sooner we can get back to being in person, the better all this will work. But I would just say, as naive as it's going to sound, try and stay above the fray. You're talking about topics that, while people might have opinions, some of them are just, in my opinion, so broad and so big. Do you want everybody to have broadband? Do you want everybody to have skills training or whatever? That's the best I got for highly partisan. I'd love to know how it works, though.
And then also in this space, and then I'm going to ask, we have a question about environmental health, but
Yeah.
people are curious about how you pulled together this group of advisors, and also what is your plan for sharing the recommendations after they've come out?
Yeah, so we're very public, and I've been in the community for 40 years. So I say that only because I'm older, but I say that because I personally we asked these people, and I asked 16 people to get to 15. So people were very interested and excited about the opportunity. I blatantly lied on the time commitment, because that was the other thing I needed to do. So you're talking to a college president. I said, it'll be an hour every other week. Well, it may be a meeting of an hour every other week, but there's all these things we want you to do in between, and we're going to ask you to do outreach and show up at things. But there was a real sense of responsibility. I mean, what's the old saying? If you want something done, you go to people who are very busy already doing things. Sometimes, though, it was, most people here in Rhode Island would look at this list and not know all 15. And that was by design. So it wasn't, the head of this union, it wasn't the head of this association that gets asked to do everything. We wanted some fresh thinkers, some new thinkers, tried to get somebody from education, tried to get definitely healthcare, tried to get somebody on economic security and the economy, but basically people who could think. Former head of the United Way, who retired, balance the age thing, the head of our Latino Policy Institute, who's in her late 20s, to get both that perspective and her fresher thinking. But really was just ask them, and in most cases they were honored to be asked, and it's why we had our senator talk to him, and why we had the governor talk to him to validate it. At the end, as I said, we keep saying we're going to come up with 3 to 5 big ideas. We have to get beyond just the topic and say, this is what you would need to do it. And then what we will debate, we've already started in our minds, is how much we then get into implementation and accountability. Because handing this off to our esteemed leaders, half of who will turn over in the next couple of years because of election cycles, without a body, legislation, something that says, here's how implementation is going to be done, and accountability. So that question of not sitting there in 5 years saying whatever happened to that money, it needs to be very transparent. We're committed to very transparent. That's why people will do it with us, because it's transparent. You want to know who the 15 are? I send it in 5 minutes. It was covered in the press who the 15 were. And that's when my phone started ringing off. We had, and I'll just share this within whatever the circle is. I don't know how big your circle is, but our senior senator, I know very well, called after we put this out and said, thank you for doing this. This is great. And then he got to the point. He said, I've gotten a couple of calls from labor folks. Would you put somebody from labor on your group? I couldn't say no fast enough. I just said no. And it's because we're independent. And, I wasn't rude about it. I explained no special interests. We're not, I said, we will make sure. So you talk about under the tent, that we talk to whatever labor means. Labor has many forms, but it's the folks who want to build a lot of buildings and put people back to work. I get it. We will talk to them and we'll get their idea. And that's the way we'll do it. But we won't, our major University of Rhode Island, how come there's nobody from your island? So again, we didn't do it that way. I said, why do you want to be on there? I said, oh, we've got a lot of buildings we want to build. We want to get this money. That's why you're not on there. Submit the idea, though. You don't have to be around the table. So it's going to be up to us to prove that we are willing to listen, and we will listen, and we're willing to commit the time and resources. It'll probably be a bigger pain than we thought it was going to be, just to hear that. But that's what we're doing.
So we have one more question, and then Judy, I'm going to ask you to maybe take yourself off mute after we get this next question to speak a little bit more about your comment on private foundations, and then want to open it up for other conversations and others who may be also in thinking about this space or already are doing work in this space. And also, I will say, last instruction, please feel free to share any questions you have for Jeff And I think this one on the environmental may be a bit of a crossover for the two of you in terms of what priority is being placed on supporting environmental health with the influx of money. And if funders have not worked in environmental health before, is there room to incorporate it now in rebuilding efforts?
Yeah, from our point of view, again, starting out agnostic with a clean slate, it will be up to somebody to bring that up. So we've already heard from people, and this probably isn't the full answer, but on resiliency and climate change and ideas for that. I don't know if that, I don't know enough about environmental health and where that fits with social determinants of health and intersecting with environmental resiliency. And Jeff, you may have more on that.
Yeah, I mean, I think a lot of this is going to depend on what communities decide, but actually specifically with the fiscal relief money, examples that the Treasury Department gives do include things associated with environmental health, like replacing lead pipes. I think this is where Neil's comment about we don't know what else is coming down the pike. You know, if there really is a major infrastructure bill, then maybe you'd want to use the infrastructure money for the lead pipes. But if it's not coming, you may want to use the fiscal relief money. So this is a tension. You, I think, Neil, have the advantage that the legislature is not rushing into making these decisions. And so you'll have, when the final decisions are made, you'll have a better idea of whether there are going to be these other resources available. But some jurisdictions are making decisions pretty quickly. And that, you know, hopefully one can revisit these decisions if another source of funding comes along.
Yeah, no, that's right. And so when, you know, even within our small group, when people see that in California, they may give out their own relief funds and things like that, you know, people start raising up. But again, without being redundant, I think the biggest challenge we're going to have is not to play small ball and not fall victim to the, we could easily say carve out $100 million for $101 million projects and you'd make a whole lot of people happy. Whether it would get much done or not, I don't know. But trying to figure out some of these bigger things that we've never been able to tackle before is really the goal if we can. And again, anybody, I'm at the Rhode Island Foundation, rifoundation.org. You can find me if anybody has specific questions that I can answer, but we're really at the starting line like everybody else is.
Great. Oh, thank you. I think might be a little further in the starting line than some others. Judy, you had put a comment in about the comparison of community foundations and private foundations, and I'm just wondering if you could elaborate a little bit more on that.
Well, sure. It's just IRS rules around what private foundations can and cannot do. And a community foundation is perfectly poised to be the convener when it comes to governmental entities. We walk the line very carefully around that, though we care deeply around policy. But, you know, we've got a very conservative board and we have to be really careful about what we do. I also am very concerned, and I'm in Texas, so that's a really large place. Right. Can't even imagine doing something on the statewide level. I'll be doing good if I can do something within 2 counties where I am, which is about 1.2 million people. So that's a big space. And we also are the most impoverished in the state and in many parts of the country. So we've got a lot of health disparities here and a lot of different needs. So I'm also concerned that the money is just gonna, like, who knows where, into drainage, you know, projects and all sorts of things like that. We have very few of the cities who have thought about a long-term broadband plan, which, you know, that would be a great way to kind of think about some of this, but we're in a difficult space and I'm just doing the best I can and educating some of the cities that, you know, I can on some things to think about.
Yeah, we do a lot of work with some of the larger private foundations here, but different on this. So in the other places we work, we're doing something on education, they co-fund with us. You know, it's something that might be in your priority area, co-fund, and you may represent a view, you may represent a geography, you may represent just plain old money, which is always in need. Probably a little different on this one. And we're the extreme from Texas. We don't have any counties. We're we got 1 million people in the state. We hung on to our second rep by a real big census count. And thank goodness Texas and Florida didn't do a big census push. So we kept our 2 and others didn't get as many. So it's a little different, but I understand that. We very much embrace our broad charter as a community foundation, but we work with private foundations on a lot of other things. And if they had ideas, there would be just as somebody have an idea. Doesn't mean
well, and kudos to you, because it's really about leadership. So obviously, you know, you are a respected leader in your state and can handle spearheading something like this. And that's great. And we also learn quite a bit from that.
Yeah.
So thank you.
Yeah, thanks. It's leadership in the void. You know, whoever steps up gets it.
I think it's more than that.
Thanks.
Well, thank you for that. So let me open it up and see if there are others who are engaging in this space at the starting line, past the starting line, trying to think about getting in the race and what you are contemplating and struggling with. Sheldon, do you want to share some of your thoughts in this space?
Sure. Thank you, Kara. Good afternoon, morning, good morning, everybody. I'm Sheldon Weisgrau, VP of Health Policy at Missouri Foundation for Health. And we have been doing some thinking around this area. So we were asked to just briefly share what we're doing. I want to commend Neil's presentation. I mean, we obviously share the broad goals that Neil outlined about equity and inclusion and community input, addressing social determinants of health. Missouri is one of those highly partisan states that was referenced in the chat. We actually, like everywhere else, we have a lot of talk and activity going on, both within and outside government, about these funds. Nothing has really coalesced. Like Rhode Island and probably most other states, our legislative session ended and most of the money that was allocated to the state was not appropriated by the legislature. And so we're likely looking at special session this summer or fall to do that. We have had some political rhetoric around cautioning about using one-time dollars for things that need long-term funding to be sustained. And so I think that caution is in the air and that maybe steers folks in a particular direction. But in terms of the Missouri Foundation for Health, I want to just really broadly talk about 2 areas that we've been looking at. The first is public health. Before the ARP, we actually started an initiative to look at transforming the public health system in Missouri. COVID, like everywhere else, exposed the fractures in the system and the kind of the long-term neglect of public health in this state. It's been chronically underfunded. It's highly fragmented. We have more than 100 local public health agencies that all operate independently. So we brought on a veteran local public health leader to lead those efforts. And the first place we're really focusing on is that public health workforce money that Jeff mentioned at the beginning, the $7.6 billion nationwide. It looks like about 76 million of that will be coming to Missouri. And there's a big concern that both the state and local public health agencies are going to be overwhelmed and won't have the capacity to even know where to begin with that money. And so we are really working behind the scenes at this point with our contacts in state government just to make sure that we and other folks that are interested in public health around the state can have a seat at the table and offering up our services to help see if we can take some of that pressure off state government in helping to try to decide how some of that money gets spent. I will point you all, for those of you that will be attending the GIH conference, there's a session on June 9th that some of my colleagues from MFH will be leading that will be talking about catalyzing this public health transformation that will, I'm sure, get into more details, because I'm sure we'll know more in a couple of weeks than we know today about where that stands. The other broad broad thing that we're looking at is we're very interested in the funding that's going to be flowing to local communities and how that will be used. We have partners in the state like the Missouri Budget Project that have already done a great job of breaking down those dollars into the kind of map that you saw Jeff put up for California. We're really at this point looking at information. I mean, we're interested in better understanding how local leaders are planning to make these decisions, how they're planning to bring in members of their community and make sure that there's diverse planning groups. And because we're a health foundation, we're specifically interested in how this money gets spent to improve health. And obviously, social determinants is broad enough that there's a lot of areas that this money can be spent in that can have long-term health effects. And so we are interested right now in finding out how those decisions are being made. We're engaging with a lot of partners, both nationally and around the state, to determine for communities that are in particular need on health status or health equity or other social determinants of health indicators, what kind of help they might need to make decisions around making sure that some of that funding gets channeled into pro-health areas and giving those communities the support they need to make those decisions, and also looking to leverage some other partnerships. And so, for example, we're talking to the Federal Reserve Bank in St. Louis about identifying needs in some of these communities and helping point them to other funds that may be available outside the ARP, so that we can really use the ARP money to leverage other funding. The other thing I'll throw in is just kind of a personal interest of mine, which we're kind of also working a little bit behind the scenes on, which is, Missouri, probably like a lot of other states, our state data systems are hopelessly outdated. And it seems like a great use of one-time money would be investing in the systems that run Medicaid and all the other state benefit programs. And we hope to make some traction there as well.
Thank you.
Kara,
Yep, go ahead, Jeff.
just add one comment to that about data, which is incredibly important, which is what's not on that chart and is not in any of the links that we are providing is the almost maybe actually more than $1 billion that through 2 appropriation cycles and some of the CARES Act money, Congress has appropriated for rebuilding the public health, modernizing the public health data systems. Some of those decisions are going to be driven at the national level, but that's going to be a lot of money flowing to states. And it's going to be really, really important that public health departments not build a gold-plated, wonderful, modern public health data system that doesn't work well with all of the other data systems that might be in the state.
And I'll just add, Kara, actually, I'm actually on this webinar to get some ideas from some of the other folks as well, because I think we're all scrambling to try to get our arms around this. And so I'd be really interested in hearing how some of the other funders are addressing this.
Thank you. So that is a perfect segue to hear from others. I also, on the data note, definitely support that, as well as interoperability. And making sure that we are building data systems that allows us to track disparities, since we have had challenges with that over the past year for sure, but other places. So other folks, what are we struggling with? What are we thinking about?
I can start. I'm Suzanne Feaster with Vitalist Health Foundation in Arizona. Our board said there's lots of money coming in. We don't want you to do more. We took an additional 20% out of our endowment last year to deal with COVID issues. But what we want you to do is try and see where could those investments make the biggest impact for reducing health disparities. So we've hired a team of consultants, and Rose Connor's on here today helping. And what we're going to do is survey the states, cities, tribes, to look at who's your point person. So at least we know, to Neil's point, we want to know who the players are in distributing the funds. And then we're using My Sidewalk data platform to show them the disparities in housing, in food, in transportation, and in healthcare, to talk about how they might direct those funds to address those disparities. And then what we'll do is, once we have that database, if you will, is bring those groups together and try and engage those administrators, if you will, that are to try and work together and build on some of the collaborations that are already going. But the first we thought was, let's get a handle. Arizona's receiving about $12 billion with a $7.1 million population. So, and we're a statewide funder. So we thought we would try and bring them together and then kind of insert and influence the discussion about the need to address health disparities.
Thank you. Any questions for Suzanne? Okay. And I see, Judy, you chatted in to the group as well. Do you want to talk a little bit about that?
You know, I can't, again, lobby and advocating is a careful line to walk, but I can communicate the things that are important to our foundation and the things that we're investing in. And I can also say that, you know, we do have a preference towards the cities that are taking a long-term approach and sustainable approach to some of the issues that we're seeing. And, you know, I'm seeing in our area, lots of cities pop up little Wi-Fi towers and, you know, just waving their hands in success. That's a piece of it, but that's a really expensive Band-Aid. So, you know, we're saying, you know, if you need help finding you know, some engineers to give you a long-term sustainable broadband plan for the city, you know, we'll be happy to visit with you, and we'll be making some investments in broadband. But first, we're watching and waiting to see what you're choosing to do with this stimulus money and do the right thing, to make a wise choice, you know. So, you know, we're in a very precarious position with what we can say.
And maybe one other question that I have for the broader group is, how, if at all, is this money changing the way that you're thinking about or are planning to do your grant making in the coming year?
I'll answer one question. We're really pushing like our Medicaid, our housing director, the counties to really think very clearly about braiding funding, because they are so siloed, even in like the county. Human services is separate from housing, is separate from senior services, and they're not connected to the Medicaid agency. And we've said now is the time to braid that funding and look at it very carefully. Our Medicaid provider is really going just warp speed on incorporating social determinants of health. And so we're saying you just absolutely need to braid that funding so that the cities are not doing mental health, for example, when the Medicaid agency can pay for that for Medicaid eligible participants. And it's just a culture change. They, you know, cities don't see themselves as doing health. So you have to talk them into, yes, you're really doing health. You just don't have a health department, but here's how you're doing health. So we've spent a lot of time in influencing that interdisciplinary conversation.
Thank you. And how has that been received?
Actually pretty well. And it helps sometimes when the wrong person leaves and the right person shows up. So sometimes you get the grace. We had a retirement for our director of housing on the state level, and it was like a gift from God when the new guy showed up. So sometimes you're lucky.
Thank you. We will go ahead and end a little bit early, and I want to thank Jeff for his presentation and taking the time to speak to us today and to give an overview of where things stand. We will be sharing all of the resources that have been provided. We'll get the information that Neil shared. Also wanted to note that my colleague Allison chatted in some resources for those who are interested in environmental health. to talk about how the American Rescue Plan Act is helping in that space as well. And thank you, Sheldon, for the plug for our annual conference that is coming up. So if you have not signed up, registration closes next Friday, and the pre-conference workshops will actually be beginning next week. And we have the full conference beginning the following week on June 8th. Much more conversation around these topics and other interesting and important topics around the administration, equity, climate change, as well as mental health, and where we are going to build a more equitable recovery. So again, thank you so much for the conversation today. We will look for the follow-up email from us with the resources posted on our website, and hope you enjoy the rest of the day and enjoy the holiday weekend.